see a hand. Okay. HJF Nairobi. HJF Nairobi. Thank you. Thank you. You can lower your hand. HJF Kisumu West. Anyone from Walter Reed Kisumu? Seems like we have none. Migori CHMT. Anyone? You can raise up your hand if you are in the call. Okay. KCCB Cup. Thank you. Callistus, you can lower your hand. Just lower your hands. Next is Sihebi Mara. Thank you. Lower your hand now. Just lower your hand. Okay. CHEB Connect. CHEB Connect. Anyone? Thank you. Jamii Tekelezi. Thank you. Please lower your hand now. Kindly lower your hands. UN Crisp. Thank you. Lower your hands now. Next, we have the LVCT prisons. LVCT prisons. Thank you. You can lower your hands. Next, we have Kogri. Kogri. Kogri, not yet. Nyeri CHMT, anyone? Nyeri CHMT, thank you, Wairimu. Just lower your hands. AHF Kenya. Thank you, Geoffrey. Just lower your hands. Hope Worldwide. Thank you. Lower your hand, please. Next, we have Faharia Jami. Faharia Jami. Thank you. Thank you. You can lower your hands. Chuck Chapuzima. Thank you, Victor. You can lower your hands now. Okay, we have USID Stawisha Pwani. Thank you, Caroline. Just lower your hands now. Next is CHS Tegemeza Plus. Thank you very much. Please lower your hands. Just lower your hands, I've already taken note. Thanks. Next is faith-based sites in eastern slums of Nairobi. Faith-based sites in the eastern slums of Nairobi. Anyone from that organization? Okay. Imarisha Jamii. Imarisha Jamii. No one. Bomu Hospitals. Bomu Hospital. Thank you, Evans. Please lower your hand. Dreams. Okay. Coptic Hospitals. Thank you. And last, MPEG. MPEG. Okay, we don't have it. All right. So I think now we've taken statistics on the attendance. So I think just to save on time, we just need to get started. I'll just share my screen just for you to get the URLs, the links. So we have two links here. The first link is the link to the online instance of AfyaSTAT. The second one is an online instance of the Kenya EMR. So as you know that there is an integration between AfyaSTAT and Kenya EMR. That means that the data captured on AfyaSTAT gets synchronized seamlessly into Kenya EMR. So we'll see that we'll be doing our entries on the AfyaSTAT, and then we'll be following that data and see if it exists in the Kenya EMR instance. Okay. Yeah. So I think I hope you've copied the same. I'm also going to paste the links on the chat area so you can get them from there. So as we begin, I'll request Diana To from Palladium to make a very brief remark. Diana is our our product manager, product management lead. So she'll just give us a brief remark, and then we'll start our training. So Diana, if you're on the call, kindly make some remarks.
Good afternoon, everyone. We are very privileged to have you in this call. So we are very excited to have this training, and we want to thank everybody who has joined this call. This is in line with what we had done when we were in Nakuru. We were in Nakuru a month ago, where we did a training needs assessment, and one of the feedback we got from that training needs assessment is that the feedback from the partners is that they needed to be capacity built better on AfyaSTAT. So for this quarter, one of the things that we'll be following very closely is to ensure that we capacity build the partners and also the facility staff on AfyaSTAT navigation so that the uptake of this product can improve. Currently, there are very few facilities that are using AfyaSTAT. So we just want to ensure that we capacity build everyone so that they can be comfortable to roll out this product in their facilities. So feel free to just give us comments on the chat if there is any feedback on what needs to be improved for the sites that are using this product. We'll be very happy to get that feedback. And for the people who will be seeing this for the first time, please feel free to ask questions and also give us feedback on how we can improve this product. So without wasting so much time, I'll take it back to Otieno. I think we are 23 minutes and we've not started. So I'll take it back to Otieno. Over to you.
Thank you. Thank you very much, Diana, for those remarks. So I guess we have taken note and we are ready to start the training. So little housekeeping. Should you want to interrupt the facilitator, you have a question or a comment, just raise up your hand, then I'll give you the mic so that you can verbalize your question. But if you feel like you can just type, please do so. Just type your question. Our team is here. We'll be able to respond adequately to all your questions. So without much ado, I'll usher in my colleague Frida to just start us off. I believe you guys have seen the links from the chat section. Just access the AfyaSTAT link so that we can do this together. Thank you very much, and karibu sana, Frida.
Thanks so much, Bernard Otieno. Please confirm that you can see my screen and that I'm audible enough. Okay, thanks Ajong. So good afternoon, everyone, once again. So I'm going to take you through AfyaSTAT navigation. So I've already shared my screen. So basically, if you want to access AfyaSTAT, this is the first page that you're going to see, the login page. So of course, the login page will be visible and each and every single provider will be able to have their own login credentials. So the moment you log into AfyaSTAT, this is the page you'll be able to see. So the Jamhuri plus sign house that you are seeing on our extreme left is basically the facility. So if your facility is well configured and AfyaSTAT is installed, you'll be able to see the name of your facility under where we are seeing Jamhuri. Please remember that this is test data. So whatever you're going to see here is not live data, but it's test data for the purposes of training. Again, under the facility, you'll be able to see some icons of persons and then hearts depicting facilities. Those are the providers in those facilities. So if at all your facility, again, is well configured with AfyaSTAT, you'll be able to see the different providers that are able to provide services using AfyaSTAT in your facility. If you scroll down, there are a couple of test data with test names. Those are basically the patients in the facility who've been tested using the AfyaSTAT application. Okay, so without wasting any further time, I'm going to dive into registering a client. So we're going to do a walkthrough on how to register a client in AfyaSTAT, how to test them, fill out the Hts forms, and then after that, how to link them. And then you're going to sync this data into Kenya EMR. Then you're going to log into Kenya EMR, and then you're going to see if that client exists in Kenya EMR. And then you're going to open their profile to see if what you filled in AfyaSTAT is what you're able to see in Kenya EMR. Okay, so I'm going to register a client. So for you to register a client, you click on register client. There's an icon, register client, down here where my cursor is pointed. So I'm going to just click on register client. This is a dummy client, so I'm just going to give them a name, test January AfyaSTAT. Okay, so scroll down. Remember, when you're registering a client or when you're filling in the registration form, it's always advisable to fill all the relevant fields, even those ones that are not marked as with asterisks as mandatory. So if the client is of age and they have national ID, it's good practice to just enter all the data you possibly can collect. Client number, if at all the facility gives serial numbers for clients who visit the HTS, or clients, yes, who visit HTS for testing. Sex of the client, whether they are male or female. So for the purpose of demonstration, we're going to work with a male client. Does our client know their date of birth? So if you say yes, AfyaSTAT gives you provision of entering the date of birth in form of year, month, and date. That is the exact date of birth. If at all the client doesn't know their date of birth, then there's also the option of estimating the age. So we're going to estimate that this client is 35 years. So because the client is of age, then you're able to see now the marital status, whether they're married, polygamous, monogamous, and all those other information. So for this demonstration, we're going to assume that the client is married, monogamous. Primary occupation, you get to choose the appropriate one when you're doing registration. Education, you get to choose the appropriate one. Nationality, so we have literally all nationalities. So you'll also get to choose where this client is coming from. But for the sake of our demonstration, I'm going to say this client is from Kenya. Contact of this client. If the client has an alternative contact, just enter that as well. Postal address, if the client has, you enter the postal address. Email address if they have. County of residence, so we're going to assume that this client is coming from Makueni County. Sub-county of residence. I hope you can see that when I clicked county, you get to choose and not type county. Same case with the sub-county. Again with the ward of residence. And then location of residence. And then sub-location. Just going to copy the same as location. Same as village of residence. Again, I'm going to use the same location as a landmark. So Kathunzweni, maybe market. If at all you know their residence, you'll add that information. If at all you know the nearest health facility, which in most cases the information is readily available, you enter that detail. Then we have the next of kin details. If this client has a next of kin, also capture the next of kin details. Just going to say the next of kin is test. The relationship is partner, and maybe if they have a phone number they're willing to disclose, you input. If they have a postal address which they're also willing to disclose, you input. If they have an existing relationship with the index client, you're able to also add that here. That is basically if you want to link this client to another client with their index and they already exist in AfyaSTAT. So if you say yes, then the system allows you to search for the client you want to link this client to. So I'm going to link this client to a random client that is already existing in AfyaSTAT. But if this is being done in the facility, of course, you'll be able to search for client because you'll know the client, the exact client that you want to link this client to and the relationship to the client. Okay, so basically that is how you fill the registration form. of AfyaSTAT. It's pretty straightforward. It's very straightforward. So once you've done that, then you submit. So the moment you submit the registration form, again, the system takes you back to the profile of this client. You'll be able to see a summary of whatever you just filled for this client. So you can even scroll down. You'll be able to see if at all there are any other forms you fill, they'll appear down here. So I think we'll see more of that as we go on when we are filling those other forms. So once you've registered the client, ideally the next thing you're supposed to do is to assess them, whether they are eligible of being tested or not. So under there's new action, and click on new action, and then you start Hts encounter. So I'm going to backdate so that we capture the encounter. Let's work with a client that came in December last year. So the assumption is this client came in on 1st of December last year. So that is the day we are seeing these clients. So when they came, they were tested as new clients. So after being screened, were they tested before? So you'll be able to say yes or no. So basically what you're filling right now is the eligibility screening form in AfyaSTAT. So if this client has ever been tested before, you'll say yes or no. If they've never been tested before, automatically
Yeah, sorry, I think we lost Frida's screen for a bit. I think it will be network. Oh, thanks. She's back. Welcome back, Frida.
please confirm where you lost my screen.
Just about 30 seconds ago.
Okay, so let me just cancel this and fill the Hts eligibility screening form again. Sorry about that. So once you register the client, the next form that you're going to be able to fill is the Hts eligibility screening form. So as I'd mentioned, you're going to backdate this to December 1st. So you're going to select whether this client is being tested as new or retest, or the client is being linked. So again, if you click next, then you'll be able to choose if at all this client has ever been tested before. So if you say yes, then the system will ask you for the test result. If you say they were once positive at any time, then by default, this client is not eligible. If you say this client has never been tested before, then by default, this client is eligible for testing. So for our case, we're going to assume that the client has never been tested before, so that we see the full cascade of Hts testing using AfyaSTAT. So I hope everyone is able to see the Hts screening status that pops up when you say the client has never been tested before in green, and it tells you that the client is eligible for testing. Then you say next. So once you've clicked next, you'll be able to see a summary of whatever you filled for the client. The Hts eligibility screening form is a very brief form. So you'll be able to see whatever you filled for the client, like we're able to see tested for HIV before is no, and then we'll be able to submit the results. In any case you want to edit that form, you simply click on cancel before you submit, and then you edit the form. Once you've submitted the form, you'll not be able to edit the form again. The next time you're able to edit the form or platform is if you go to Kenya EMR after syncing this data, then you can access the client's profile and edit the information from there. So once you've entered the form, I think now we can see under reports, we're able to see the form that we filled. It populates down here. So we can be able to see that we've filled the start Hts encounter for this client. So the next thing, if you click on action, is the Hts Initial Form that basically comes up after you are certain that this client is eligible for testing. So again, we're going to use the date of December 1st as the date of test for our test client. So what we have here is the Hts initial form as it is in the physical form. So population type, you'll be able to select the correct population type for your client. So if the general population, if they're key population, you notice that if you click on key population, you're able to see a whole segregation of the key population types. If they're priority population, again, you're able to see a whole segregation of the priority population type. So for the purpose of this training, we're going to work with general population. Does client have any disability? If you say yes, again, you'll be able to see the various disabilities and you'll be able to choose appropriately. For this training, we're going to say the client doesn't have any disability. Has the client ever been tested for HIV by an HTS provider before? If you say yes, the system will ask for the duration since last test. If you say no, we'll go to the next step. Has the client done HIV self-test in the last 12 months? Again, if you say yes, is the client willing to share self-test results? Again, if you say yes, the system will ask you for the test results, whether the self-test kit result was positive or negative. I'm going to say it was negative. And then you'll be able to also enter the date of the self-test. Okay, if you scroll down, now the system will ask you the setting in which this client is being tested currently while you're filling this form. So whether it is community, if the HTS providers have gone for outreach, or it's just within the facility, you'll be able to select appropriately. So if you say community, under HTS strategy use, you'll be able to see whatever appears there are things that are related to testing when done in community. When you say facility, the strategy changes. You are now able to see strategies that are mostly used when testing is done in or within facility. I'm going to say this client is tested within facility. Then the approach that was used, was it provider initiated or client initiated? Be able to choose appropriately. Then the strategy used, integrated VCT center, again, you'll be able to choose appropriately. Then the indicate HTS entry point, how the clients came to be tested into the facility. Were they outpatient clients or inpatient clients, or they came for pediatric clinic? You'll be able to again choose appropriately. So you're going to assume our client just walked into VCT to be tested. As the client consented, you'll be able to choose yes or no. If they've contested, are they being tested as individual or couple? If you say the client has not consented, that means the client has not agreed to be tested. That means if you enter this form, if you click next and you submit, that is basically the end of, there's nothing much you can do to this client except maybe elicit for PNS for contact, okay? But you cannot test the client because the client has not accepted to be tested. So you're going to say this client has accepted to be tested, so they have consented. So again, is the client being tested as individual or couple? You'll be able to choose appropriately whether they're being tested as couple or individual. And then now, what kits is the client being tested by? So normally the first test kit is normally the determine, so you'll choose appropriately. Also, enter the lot number, which is a mandatory field, and then the expiry date of the lot number. Okay, then the results of the first test, whether it was positive or negative or invalid. So I'm going to choose that this client is positive, because remember we want to see the entire HTS cascade in AfyaSTAT. Test 2, I think we all know we were previously in the previous version of AfyaSTAT, we were able to see both determine and first response as under test 2, but now, as you can see, we only have the first response, which is the correct kit that is supposed to be there when someone is being done for test 2. Again, I'm just going to put in dummy lot number, and then the expiry date for the kit, and then the result, which is still positive. Okay, so you'll be able to see that the final result is positive. Then the system will ask you if the results was given to client.
Just to interrupt you, Frida, I think somebody called Moses Mia has a question. Moses, would you like to just verbalize your question? I've given you the mic, just unmute and ask the question. Okay, seems we've lost him. Just proceed, please.
Okay, thanks, Atiana. So if the results were given to the client, you'll be able to indicate yes or no. If TB screening was done to the client and the results known, again, you'll be able to indicate. If the client was referred for confirmatory testing, you'll be able to again indicate, because basically after the first test, they're supposed to go for a retest, which is the confirmatory test. So it's a mandatory field. And then if the confirmatory test is supposed to be done in this facility or the next, you'll also be able to indicate. So if it is this facility, of course, we had already figured in AfyaSTAT, so the facility that you are doing the test will automatically populate the facility name. If this client is being referred to a different facility, then you'll be prompted to put in the facility name where this client is supposed to be done for the confirmatory test. Okay. So consent for PNS, if this client has agreed to list their contacts, again, you'll be able to indicate, and then you click on next. So once you click on next, again, you'll be able to see a summary of whatever you've just filled in the initial form, Hts initial form. As I'd mentioned, if you decide to submit, then you are not able to edit this form unless now you go to Kenya EMR. If you feel like whatever you fill, there's an error somewhere, then you can cancel and fill the form again. Okay, so I'll submit the form. Again, if you scroll down, you're now able to see that this client, we've done for them Hts initial. We fill the Hts initial form and also the Hts encounter, which is the eligibility screening form. So at this point, you can decide as a clinician, maybe to elicit for contacts from this client, so you'll be able to add contact, or you can decide to continue. And if this client is being linked or being done for confirmatory testing in the same facility, you can decide to just go ahead and fill the Hts retest form. So you're going to fill the retest form, then we'll come back and add contacts. So the retest form is pretty much the same as the initial form. So I'm going to backdate this to the date that we've been using, 1st of December. You notice that most fields are already populated, because I mean, if you're general population, you're just general population if you're being tested the same day. Same case with disability, and also if you've ever been tested before. And the other part of willing to share.
Sorry, seems we've lost Fred again. I think it's a network issue. Let's just allow her to reconnect back. Sorry for that. Yeah.
Okay.
Yeah, so, I think Frida is back, but you might want to. Oh, now it is okay.
Okay, sorry about that. I think it's my network. So So as I had mentioned, most parts of this form are pre-filled from the Hts Initial Form. So like the first parts are already filled out, the population type, disability, and whether the client has been tested before by a provider or self-test. Remember, we had said that this client had tested themselves using the self-test kit. So during the retest, they also ask if they're willing to share the self-test results. So yes or no. So I'm going to just say yes, and whether it was positive or negative, and then the date that the test was done. Again, the setting where this test is being done. Remember, someone can be tested maybe when the providers have gone for outreach for the first test, and then the retests be done at the facility, or vice versa. So again, you'll just be able to indicate where the test and the setting where the retest test was done. So whether it was provider initiated or not. Again, the strategy that was used and the entry point. And then whether they consented or they have consented to be retested, and whether they are being retested as an individual or a couple. Again, the test kit that is to be used, whether it is determined or dual kit, you'll be able to indicate appropriately, then the lot number. Again, you'll also be able to indicate the expiry date of the test kits and the final results. If you scroll down, test 2, first response, again, indicate the lot number and the expiry date. And then the results of the test. So we're able to see that the final result is positive. So you indicate whether the result was given to the client or not, whether they were screened for TB, and whether they've now been referred to CCC, and if it's the referral is in this facility or another facility. I think we already saw that if you say other facility, you'll be prompted to put in the name of that other facility. If you scroll down, there's also consent for PNS if this person is willing to give out the name or names of some of their contacts, and then you click next. We're also now able to see a summary of whatever we've just filled. Again, remember, if you feel like there's a part that you've entered wrongly, you simply cancel and you go back and fill the form again. If you submit, you can only make those changes in the EMR after syncing the data. So I'm going to submit. If you scroll down, we're able to now see a summary, the date when this client was last tested, the result, whether they consented for PNS, and whether they've been linked or not, and the facility and the UPN. So as you can see, there is a blank under the facility and also UPN because we've not linked the client. But you can see that we filled 3 forms. Okay, so if you click on new action again, you're now able to see.
Yeah, you're back.
Okay.
Yeah, today you're back.
Okay, so if you click on new action now, you can see that now you're able to, if at all this client was tested, initial test was done, retest was done, and then maybe they say they need time to go and maybe think about it before they come back and they never come back, you can decide to trace the client using the HTS client tracing form, which you're going to see, and then now we're going to fill in later the referral and linkage form. So if this client disappears, you can trace them. So we have the tracing form in AfyaSTAT. So first things first, date of trace. So we are going to say we trace this client on the 6th of December. And this client was traced using a phone, and you can even see that you can call the client. Remember, when you're doing registration, we had entered the phone number. So when you click here, it basically links to the phone that you had entered, and you can call the client. And then the tracing outcomes, whether they were contacted and linked, or contacted but not linked, or they were not contacted. So you're going to say this client was contacted, but they are not linked. And then we click next. And then submit the form. Remember, you can trace this client as many times until you get a hold of them and link them to care. So that is how you fill the tracing form. It's very easy and simple. So once that is done, then again, as I mentioned, you can trace the client as many times as possible. But remember, once you've linked the client, then you'll not be able to access the client tracing form. So I'm now going to fill the HTS linkage form. So we're going to link these clients on the 8th of December. Okay. So the client is being linked in this facility. You can see the facility name pops up. And then now this is CC number, which is also very mandatory. And it also has to be 10 digits. You can be able to see the pop-up, the alerts. So mine was 11 digits. So once you've done that, then you're supposed to enter the details, the name of the healthcare worker who was handed to this client, and then the cadre of that healthcare worker, the date they were enrolled in care. I'm going to use the same date, and the date they started taking ART. And then if you have any remarks as a clinician or the provider, you key in your remarks, and then you click next. I'm sure you're able to see that date enrolled is mandatory. ART start date is not mandatory, because as we all know, there are some clients who are not started on ART immediately. They're enrolled in care. So that's why initially it was mandatory, but right now it's not mandatory. So this date is not mandatory, but it's a good to have field, especially if the client is being started on ART, the exact same date they're being enrolled in care. So I'm going to click on next. Again, that is basically the HTS linkage form. I'm going to submit the form. Now, if I scroll down, you're able to see the date of linkage for this client. Remember, before there was a red marker saying the client has not been linked. You're able to see the facility where this client has been linked and the unique patient number. Again, you'll be able to see that we fill the HTS linkage form. Something else significant once you've linked the client is that you cannot fill any other form for this specific client. So under new action, it will be inactive. So the other thing that you can do for this client is we can now add contacts. So I'm going to click on add contact. If this client has consented, the way the client you're working with consented to provide PNS details, then we can add the contacts. So I'm going to add this contact, and I'm going to use Otieno's name. So Otieno Bernard as one of the contacts. Otieno Bernard is a male. Remember, our client was also a male. Does Otieno know their birth date? So yes, let's say Otieno doesn't know their birth date and the estimated age is 50. If this client is willing to provide us with Otieno Bernard's phone number, again, we'll enter that. Relationship to the client. So the number has to be valid. I think my number is less. Yes. Okay, just a minute. Okay. The relationship to the client. So Otieno is a IPV screening questions pop up. If you say it's a child, you notice you're not able to see the IPV questions. So Otieno is a partner. So you're going to screen this client for IPV. Has he or she ever kicked, slapped, or otherwise physically hurt you? So in this case, has Otieno ever kicked, slapped, or physically hurt you? So if the client says yes, by default, even before going further, you'll be able to see that the outcome is yes, and this client is IPV positive. That means you cannot test this client. So even if we are to submit and go to Otieno's profile, we can only elicit for other PNS, but you cannot test Otieno further. Okay, so I'm going to say no. I'm going to say again no. Has he or she ever threatened to hurt you? Has she or he ever forced you to do something sexually? So I'm going to say no. So when I say no, again, you can now see that the IPV screening outcome is no. And then is this person living with the partner? So yes or no. And then the HIV status of this partner, I'm going to say unknown. And then when this client is booked to come, let's say this client is booked to come on 27th, sorry, is booked to come.
Sorry, guys, I think Frida must be having some difficulties with the network. Let us just give a few seconds to sort it out again. Did I see a hand somewhere? Somebody raised the hand and then quickly turned it down. But should you have any question, you're encouraged to just type it on the chat area so that we can be able to respond to you. Towards the tail end of the presentation, you'll also get a chance to just verbalize some of your questions. So I think, yeah, Frida is back. Let's give time to continue. Welcome, Frida.
Sorry about that. So yes, we're going to continue. So if the partner's HIV status is known, it indicates whether it's a non-positive, negative, or if they are infants, that is exposed infant, the booking date, and then preferred PNS approach. We just want to change this. Okay. And then preferred PNS approach, whether it's dual referral, provider referral, client, or contract. And then you submit. Okay. So once you submit, you're able to see. So now we are looking at the profile of the partner, one of the contacts. So you're now able to see that this contact is related to Test January, who was our main client, who is the index client. So again, from here, you can go ahead and first of all, follow up this client. So we can follow up this client for testing. We're going to say this client was followed up on the 4th. Again, via phone. Remember, we had provided the phone number for Bernard Otieno, so that is what is used. And then if they are contacted and already on ART, maybe in another facility, you'll indicate. If they were contacted and they agreed to come back to the facility, again, you indicate. If they were not contacted, again, you'll be able to indicate. Maybe they were called, but they were not found. So for this scenario, we're going to say the person was contacted and they promised to come on the 28th of January, and then you click next. If this client does not come on the date they said they were supposed to come, again, you're going to fill the contact form until you are certain that this client was contacted and found. So we're just going to fill this one more time. So I'm going to say this client was again traced, let's say on the 19th, via phone. They were finally contacted and already on ART, maybe in another facility. And then we are going to provide the details of the facility where they were linked to. Let's say this same facility and the unique patient number. And then remarks if there are any. Then you submit, okay? So we are able to see the forms for this client that we've filled and the details. I'm just going back to, I just want to go back to our initial client. I hope you're able to see that while I was in Otieno Bernard's profile, I was able to easily click on the contact to access the initial client, the index client who is test January. Again, if I'm here at test January, I can easily click any of the contacts that we had listed as either being contacts or partners of this client. So you can easily access contact profiles of these 2 or more patients by simply clicking on the related clients under the related clients. Okay, so once you've done that, remember you can add as many contacts as you possibly can for one client. If this client has like even 10 contacts and they're willing to give out their names and information, you can always add as many contacts as you possibly can. So basically that's it. So what I'm going to do is I'm going to sync this data, and then you're going to go to Kenya EMR, and then you're going to see the data that we've entered for test January, and we're also going to see reports from the other side. So if you want to sync data, you simply click on the hamburger menu, and then there is the sync now. If your application has been correctly configured to sync in real time, then the moment you made any changes to that application, all your information and whatever records you've entered will be synced in real time to the server. Okay, so I'm just going to sync now, but as you can see, all my reports have been synced. So I'm going to sync. Okay, so once you synced, you'll be able to see all reports synced. Then now I can, and you'll also be able to see the time of the last sync. So you can see right now it's 3:05, and we can see that the last sync was at 3:05. So now I'm going to go to Kenya EMR. So this is where we've configured our application to. Remember, when you're installing AfyaSTAT in your facility, it has to be configured to a Kenya EMR server where that data will eventually be synced to. So in this case, we've configured it here. So I'm just going to log in. So just give me a minute. So just give us a few seconds. I don't know if there's anyone with any question before we move to Kenya EMR. If there are any questions concerning navigation in AfyaSTAT, from registration to how to fill the forms, and also to how to link clients in AfyaSTAT, or even the syncing process, maybe you can just raise your hands and ask the question.
Hi everyone. So we are requesting while working on the Kenya EMR instance, if you would just take time to verbalize your question. I see there was a question there's one from Dennis. Dennis, would you like to just state your question? Dennis? Okay, Dennis is not forthcoming. Could we have Kevin and Kasam? Kevin? Okay, I think that is an erroneous hand. Let me just go up. There was a question on the chat by Wayne Omondi. Wayne, do you want to ask your question now? Hello? Can anyone hear Wayne?
So when if you are talking, you have to raise up your hand so that I give you the mic. Okay, when you can proceed, you have the mic. Just unmute your side and when you can unmute your mic and speak up. Anyone able to hear Wayne? When if you are speaking, kindly unmute.
Okay.
Go on.
Okay, my question was about if
We lost you.
Is there any
Sorry, we lost you. Come up again.
Is there any? My question was about if you have a client, that doesn't give you the area he or she is coming from, in terms of the landmark, the sub-county? How do you go about it?
So I think what she's asking is how do you go about documenting the particulars of a patient who is not giving you any demographics or location to where they are coming from?
Yeah, so thank you, Wayne, for the question. So I think demographics in the registration form is not really mandatory. So it's a field that you can skip during registration, but it's also, those are some of the fields that you can try and elicit even as you go along testing of the client. But they're not really mandatory field during registration, but it's the information that you can always get with time, especially if client ends up turning positive, or even if they go for Hts Initial Hts Form, you can always ask the other providers also to try and elicit to get that information. But they're not mandatory fields, so it will not stop you from continuing to test the client in AfyaSTAT.
Okay, David Mutinda, feel free to unmute and ask your question. David, kindly unmute and ask the question.
Thank you, Bernard, and thank you, Freda, for the presentation. Just a quick one. In our trial to use the system, there are a few things that we've been able to observe. Maybe I'll mention one or two, and then maybe you can pick up a side chat, but something that we're just thinking through. I think the forms are actually very exhaustive when you look at what we're using in the registers and what is in the system. We're happy that almost everything has been captured there, and we're grateful to the Palladium team. I had put in something in the chat about some of the sub-counties. We realized that some of the sub-counties in our counties are actually not correct, and that means when someone is giving the area of residence, they're likely not to know which area to pick. Like in West Pokot, only one is correct, all the others are facility names, and that translates now to the ward and the other areas. Maybe something that we can get support on. And then the other bit that I mentioned is about eligibility criteria. This system picks automatically about the testing history of 1 year, the recommendations and guidelines. In the area of efficiency, we are screening further, beyond the 1 year. So the question is, if you find someone has been tested within 1 year, but they still have exposure and they're eligible to be tested. Yeah, the form gives us an allowance to continue filling, but when you're looking at the data, it will show that many people are not eligible being tested. Now, and maybe the counselor consider the other bits of the other criteria of eligibility. And maybe the third thing is about the client name. I'm not sure what is expected to be put in the client name. We said the ones in the registers, in the Hts register. If that is the case, huge facilities, for example, Nyeri PGH, which will have several registers, and all of them are serialized differently. And it means you'll have many numbers, the same with MFL code and everything reading the same. We have a given format for filling that client number. Can it be auto-generated? Be something that you can also mention about. And maybe finally, it's about the adolescent girls and young women. The system categorizes them as priority population. Yes, we know they're part of the populations, but is the guidance that we put all of them, all the 15 to 24 girls in the bit of the population of priority populations. I think that's what I had. Others we can catch up offline a bit. Thank you.
Thank you, David, for the questions. So, if I got you correctly, you've asked about, you've commented about the incorrect mapping of some of the sub-counties, which I think you already been responded to in the chat. that we are going to check on those and follow further with you so that we can have the correct mapping on the system. You've talked about the eligibility criteria, which you've correctly put to be within 1 year as per the guideline. But I think even if the patient is not eligible, sorry, I think that was a bit of a network mashup. Yeah, so for the eligibility, I think the guideline is that they're supposed to be within 1 year. So I don't know if that has since changed. I think we can be guided, because I think below that, I don't think you're supposed to be retested if you're not eligible. So I don't know if that has since changed. We can be guided. I think we have the experts within the call. What was the other one? Yeah, I think the last bit that you've asked is about the client number, whether it can be pre-formatted, if it can take a specific format. From the last user acceptance testing forum we had with the AfyaSTAT users, it was agreed that we let that field be blank, be user defined. That means we don't impose any validation on it, so that users can put in the number as per what they would have in their registers. And again, we removed the mandatory feature so that it is not a required field. So you'll find that you can, whether you leave it blank, you can still be able to proceed. So unless that has changed, or maybe there is a new requirement that the field, the validation is reimposed, right now it is not validated. It is an open field. Yeah, so I don't know if there's anyone maybe from our team who would want to add something, would want to make a comment before we hear from Florida Kiplagat. So Florida, feel free to unmute and ask the question. Florida, kindly unmute.
Everyone, my name is Robai from, you said Ampath. I'm using Florida's machine. So I have 2 questions. So as my colleague Mutinda has said, we have implemented the AfyaSTAT app here at Ampath, and we've been getting impressive feedback from our users. So some of the feedbacks are form improvements and system improvements. So I don't know, maybe you can advise, so how to go about it. Will the improvements only be done at our Ampath instance, or it's going to be reflected in the whole AfyaSTAT app? And what is the process of maybe if we want to add any system improvements? So how do we request? And then maybe you can also tell us what is the turnaround time, because some of the issues raised, for example, under the Hts encounter forms, I think we are missing out the eligibility screening questions. So, our users, to them, it is a blocker. So if we experience such, how are you going to address it? Also, the other issue is, I'll mention, for example, under the registration form, how are we going to uniquely identify clients registered under the AfyaSTAT app? Because currently, if you want to search a client, you're going to search using names. we also have a telephone number and national ID, and you'll find a telephone number and national ID, it's not a required field. And most of the people we register using AfyaSTAT, you will find that we have people sharing names. So for example, if you have someone called Mary Chepkosgei Kipto and there are 3 in the system, how will the AfyaSTAT uniquely help us to identify these clients? Then the last point, there was another request, for example, if we could, the system could save our forms. So for example, if you're working on a form and you don't have complete information, is it possible to save this form as drafts or incomplete? Then when you have full information, you can now submit the form. So those are some of the feedback that we got during pilot and implementation of AfyaSTAT. Thank you.
Thank you. Thank you very much, Rabbi. I don't know if there's anyone within our team who wants to take up one of the questions. Yes, Dana.
Yeah, I think before you hand it over to whoever is going to respond, I said this is Titus from West Pokot. We are currently going through the same training. I think the intention of using the AfyaSTAT is to graduate from paper to electronically. My worry is, and the worry of the entire team is that even as we do the same, then we are not able to generate the report using the AfyaSTAT at the end of the month. So members are feeling that it might be difficult for us to really continue using, use the AfyaSTAT at the same time we use the registers, because that is what will give us the report at the end of the month. If it could be improved to help us generate reports, we pull reports using the same at the end of the month, then I think we can have 100% migration. But now it is a bit tricky for us. Maybe you'd want to comment on the same.
Thank you. Thank you very much. I'll invite Diana to respond to some of the questions.
Okay. Thanks, the Empath team for those questions. Maybe I can start with the last one because I think that is the easiest. So for AfyaSTAT, you can get the reports at the end of every month and all the registers at the end of every month. So I think you can just be patient. The next session we are going is on reports. So we've just handled the AfyaSTAT. Then after the data is synced to KenyaMR, you can generate the reports from KenyaMR after every month. The other question was on process for improvements. So there was a question on how to report enhancements, especially to AfyaSTAT. So we have processes for reporting those. One of them is we have a service desk. We will post the service desk numbers on the chat. So we have a tracking tool where we are just tracking all enhancements and all the bugs or any improvements that you want for the system. So that's one. Two, for every partner, we have a HRS person from Palladium that is supporting partners. So we have a point person for each partner. So for Empath specifically, I think that was Empath Dumisha. Yeah, we have Frida. Frida Oyucho is our point person for the partner. So you can liaise with her directly, and then we get all the feedback for process of improvement. So you ask if it's Empath specific. So we just want to provide harmonizations and just have one system that is gonna support all the sites. So just one version. So if there is anything that you need to improve, I'm sure other sites also will benefit from those improvements. Whatever whoever partner is floating the ideas, I think it will benefit all the partners. So all the improvements will go into one version, and when we release another version of AfyaSTAT, then it will include all the improvements that have been floated by any partner. Searching by ID or telephone numbers, I think it's not mandatory currently for you to put in your ID number. and also the telephone number. I think you all understand that if you put in too much restrictions in the system, we wouldn't want to have a situation where you cannot move because someone doesn't remember the ID numbers. So that's why the ID number is not, it's not mandatory. Same case to the telephone number. So in a situation where you have a name that is shared by two people, there are other unique indicators that you can just look at. If you search for whatever, if it's Marianne Mwangi, for example, and it gives you 3 Marianne Mwangis. There are so many things that you can just look to differentiate between the 3. One would be the date of birth, another one would be if they've put in a telephone number, for example, one of them where they live. So those are the things that you can just search. Once you get the 3, you just take time to just go through the profiles, and then you just identify the correct one. So that's the reason why we cannot, if you put in so many restrictions, sometimes you just make the system not usable. So that's why. So for now, we are just using names to search for those clients, and you can use those characteristics I've mentioned, so that you can differentiate between the different users. I believe we have put in the service desk numbers. It's a toll-free line, so you don't have to worry about airtime. That is taken care of. You just call and it's free from your end to report anything. So allow us to go to the next session so that we can also, after finishing that session, then we can have another channel for questions. Over.
Thank you. Thank you very much, Diana, for those. I don't know if there is any, maybe a follow-up question or any other question before we move to the next session. Yeah, so I think the next instance is on the Kenya EMR side. Remember when Frida took us through the AfyaSTAT application, we were able to register client, we were able to perform the screening and testing, and we were able to kind of capture all the information at each and every stage. And then that data was synchronized to Kenya EMR. So right now, I think what we are going to do is to just go through the Kenya EMR side. Unfortunately, we are grappling with the troubleshooting an error I think that has been caused by a user. I think one of our users has just changed the admin password to that particular instance. So we are struggling to reverse that so that we can take you through the same server where we are able to search for the same patient that that got synchronized. So just give us like 2 minutes, then I think we'll continue from there. Meanwhile, type your questions and your comments on the chat area, some of which we'll be able to respond on the fly. So we'll just give us like a minute or so to sort it out, so then we can continue. Okay, so I think we'll just proceed with any other instance of Kenya EMR. Seems like that might take us longer. So let us just go through what you would normally go through after the data is synchronized onto a Kenya EMR instance. All right, so I'll once again invite Frida to proceed. Thanks.
Thanks, Otieno, and apologies to everyone for the hiccup. So basically, after you've synced your data, as I mentioned before, when you're installing Kenya AfyaSTAT, it will be installed in a Kenya EMR server. So that means when you sync your data from the application, it syncs to a live Kenya EMR server. So we've had difficulties with the server that we had synced the data that we had entered in the AfyaSTAT that we are using. So I'm just going to show you reports, HTS reports, and ideally just how to search for a client generally in Kenya EMR, not specifically the one we synced when after you've synced data from AfyaSTAT. So you'll just come to registration, and then you'll search for your client. So I'm just searching for any random client. So you'll search for your client, let's say, for example, Mona Test. So if this was your client that you had tested in AfyaSTAT, then you'll come here. Of course, when you search for them, you'll find them after a successful sync. Then after finding them, then you can always go to information, check the details if they have been captured correctly. Okay. Again, this is also an opportunity to just edit out if at all maybe the names were captured incorrectly, the locations were captured incorrectly, or even the next of kin details. You'll be able to edit all those information. So let me just give me a second to just check in this client. So if at all this client was done for HTS at any point, then you'll be able to see, because by the time you're looking for this client or accessing this client in Kenya EMR, you would have filled the Hts Initial Form, the retest form, and also Eligibility Screening Form, and you'd have also filled the Linkage and Referral Form. So you'll be able to see the forms down here under Completed Visits. So just allow me to fill one form, Hts Initial Form, so that I show you how you can also edit the form once you're in Kenya EMR. So I'm just going to do this very fast. So I'm just going to fill information that are almost the same as what we filled the other side. So the client has been tested as individual. The test is and then the expiry date of the kit, the test result that was positive, and then the next test, and then the expiry date, and then the result. And then you're going to state that the result was given to the client, there was no TB sign, and the client was referred to CCC in this health facility, and then we enter the form. So you can just see that whatever we were entering the other side is basically the same as what you'll enter if you're using the HTS module in Kenya EMR. So ideally, if you search for this client now in Kenya EMR after syncing, then you go to the HTS module, you'll be able to see the completed form. Assuming this was completed the other side, then you can always click on the form, do an overview. If there's any field
Seems we've lost Fred again there for a bit. Yeah, this time around it is not the network. This time around it is the mic. Okay, I think she's back.
Yes, so I hope I'm now audible. So you'll be able to scroll down the form, check if whatever was captured in AfyaSTAT is the true picture of this client's information. If at all there's any need to edit this form, you can always just click on edit. Edit whatever field you want to edit. I'm going to discard these changes. If at all you feel that the information that was entered in that field was not correct, you can also just delete the form, but we highly discourage deleting of the form. We encourage editing the form just in cases where you really need to make the changes. Okay. So once that is done, then now from Kenya EMR now, you can now proceed to after your client has been linked to care, you can now proceed to the clinician tab and then enroll your client in the HIV program. You're not going to do that today, but basically that is how it's supposed to be done. Once the client has been tested using the AfyaSTAT and their details have been synced to Kenya EMR, then now from here the clinician will just come, search for the client in Kenya EMR, then enroll them in care. Or if at all there are any tests that are supposed to be done, if there are any lab tests or there are drugs that they're supposed to be given, then they'll be done from the Kenya EMR. Again, you can also contact list from Kenya EMR by simply clicking on contact listing and then adding contacts just the way we saw in AfyaSTAT. So I'm not going to fill this. The information that are being collected are exactly the same as what we collected the other side. So you'll just fill in the details of the contact that this client has decided to give out the information of, and then you save the patients. If this client has more than one contact or has listed several other contacts, either as family or sexual partners, we'll also be able to see the contact tree. So if you view the tree, you'll be able to see the main, the index client, and then the other contacts that this client has elicited. So from here, I'm just going to go directly to the reports. So remember, when you use AfyaSTAT and then you sync data to Kenya EMR, that data is also synced and populated. That data is synced and populated in the Hts reports, meaning if you generate the Hts reports, you'll be able to see data that came from both AfyaSTAT and also from just the Hts module in Kenya EMR. So we have various Hts reports in Kenya EMR. We have the Hts monthly reports. We also have the Hts register. We have the Hts Confirmation Register. Hts register contains information about all clients who've been tested, whether positive or negative. And then we have the Hts Confirmation Register. We're going to look at one register just after this overview to see how the reports look like. And then we have the linkage and referral register that contains a client who've been linked or referred after being tested. Okay, so I'm going to generate a report from Hts register so that we see how that register looks like. So how do you generate a report in Kenya EMR? You simply click on the intended report and then you click on request report. So when you click on the request report, it provides you the option of start date and end date. So from the start date is, this is start and end date, this is the period that you want to get the report from. If you want to see clients who've been tested maybe for the last 1 month, and the month you're targeting is, let's say, for example, November 2021. So you simply select start date as the 1st of November and end date at the 30th of November. Remember, the start date can even be faster. It also, you can also generate report for 3 months, 4 months, or even 6 months. So the start date is the first date of the reporting period that you're interested in, and the end date is the last date of the same. So I'm going to request this report. So once the report has been requested, you can view the report either on the database, the Kenya EMR database, using the view feature. So if I click on view, I'll be able to see clients who were tested. So as I can see from my screen, you can be able to see we have 2 clients. Remember, this is a test server, so we don't really have much information or much data. And as I had also mentioned earlier, that the Hts register contains both any client who was tested with a negative or positive. So as you can see, we have one client who tested negative and the other one who tested positive. Okay. Again, just from viewing the reports from the database, you can always also just click on the clients and you'll be directed to the client database. And then from the client database, you can, if at all you want to add more information about the client, or if at all there's some data that you feel needs to be edited out, or you just want to do more other services to the client, you can always do. Follow-up, data cleaning, all that thing you can do from the report section, especially if you're viewing from the database. Okay, so I'm just going to go back to the reports. Again, you can view this data in CSV or in Excel. So when you click on Excel, the register is downloaded. I don't know if you're able to see my screen. I believe you should be able to see the register. So this is how the register looks like. Of course, in a facility that is using the Hts module optimally, or even AfyaSTAT, they'll be able to see all those other clients that have been tested for that period of interests lined up with the names of the clients and the date of birth and all those other information that are collected in the register. Okay, so basically that is how the Hts register looks like. So maybe if you find time, you can just take your time, go through the Hts reports that we have in Kenya EMR and see if they reflect the true picture of what you have on the ground in your various facilities. Again, this data is pushed to the National Data Warehouse every single month. We have a docket when you're uploading data to the National Data Warehouse, a docket of Hts. So we also highly encourage facilities, as some have always been doing, to push Hts data to the National Data Warehouse. So when you go to the National Data Warehouse, there's a tab for reporting rates. We have the care and treatment as the first tab, and then we have the second tab as Hts HIV testing services. So from here, if your facility is using HTS, you can always be able to tell if you've been pushing data for HTS into the National Data Warehouse for the past 12 months. So like what you're seeing, my page is still loading. Maybe you give it a few seconds. So ideally, generally, we expect 779 HTS facilities to upload data every month to the National Data Warehouse. As you can see, we only have 76%, but I'm sure we have more than 797 facilities that are offering HTS services. So we are also urging facilities to take up the use of this module and push data so that they can benefit from the HTS data, both at a partner level, county level, and also a program level. So as you can see down here, we have the different segregations of sites that have been sending in HTS data in the National Data Warehouse. So you'll be able to confirm your facility. From the warehouse, you can always filter by the county of interest, the sub-county, or even the partner that you are interested in their data, and then you can now scroll down and see the different trends in your data in terms of reporting this. We also have another tab that now has comprehensive information of the HTS data itself, the HTS services uptake. So if you use the HTS module well and you push that data to the National Data Warehouse, then you'll be able to see the correct statistics from the National Data Warehouse. If I scroll down under the HIV testing service uptake, you'll be able to see the uptake by age, group, and sex. I think the server is still loading. You'll be able to see uptake by population type. You'll be able to see uptake by entry point, strategy, all those information that we capture in the EMR. And I think this is very important. This is a very important analysis that we can really make use of if we use the HTS module and AfyaSTAT optimally. We can really benefit from the data that we have in the National Data Warehouse. So we also have the linkage information on HIV testing service linkage. So we also have information on linkage. I think my screen is, oh yes. So if I scroll down, again, we have the different analysis and statistics on linkage, which all of us can benefit from if we use the module well. If you scroll down, we have literally all the information about the data that we collect in the EMR. Again, we are urging all of us to make use of the HTS module, as I mentioned before, to capture this data so that we can all benefit from data at the end of the day. There's so much you can get from the National Data Warehouse if we collect all the HTS data that we have outside there in Kenya EMR or AfyaSTAT. Okay, and finally, we have the PNS tab, still within the National Data Warehouse. I think my screen has lagged behind. Yes, I think we are there. So yes, so again, if you scroll down the PNS, we have, under the PNS, we have PNS sexual contact testing, and then we have family testing. Again, if you are using the module optimally and also the application mobile app, AfyaSTAT, and collecting all the information completely and accurately, you'll be able to benefit as well from all these statistics and analysis that you're able to find in the National Data Warehouse. So I'm also urging all of us to just find time, go into the National Data Warehouse, filter by your facility or your county or your partner to be able to see the data that we have in the National Data Warehouse on HTS and just compare with what you have on the ground and see if it reflects the true picture. And if it doesn't, then it's a call for you and your team, if you're a partner or a facility, to just encourage the users on the ground or capacity build the users on the ground to uptake this module, because as we have seen, there's so much you can benefit from if we have this data in the National Data Warehouse. I think that's it. I don't know if we have any questions.
Yes, sorry. You can stop sharing your screen. Okay. All right. Yeah. So, so as I was saying, the beautiful thing I think for which is a take home for us is you can see how the data moves right from the point of data entry in the application all the way to how it ends up into the National Data Warehouse, where you are able to visualize and kind of see how your data looks like at the National Data Warehouse. So up to that point, I think we are just 5 minutes shy of concluding this particular training. I just want to give very few people a chance to verbalize their questions before we proceed with the closure for this particular training. So I'm seeing a hand from Paul Kabui. Feel free to unmute and ask your question. Paul, kindly unmute. Yes.
My question is, I can see the version that we've been shown in the presentation is the updated version, but I have a question. We have not updated yet. But at times when the HTS counselors have entered the class that are testing in AfyaSTAT, we get an error, and then the patient, you can see the patient in AfyaSTAT, but you cannot see the patient in Kenya EMR. How can we troubleshoot that? Because at times we are forced to delete that patient and enter that patient again. Is there an easier way for troubleshooting such a scenario?
Thank you. Thank you for that question. I think that has been noted. The inability to synchronize and how that could be tackled. Okay. Do we have another question? Any other question?
Maybe. Okay, so maybe there's a question I hadn't answered previously. Maybe I can take that. There was a question on code sharing that is from our friends and colleagues from AMPAS. So yeah, so there is a process of that. We already established a community of practice, and one of the reasons why even we have the communities of practice is that so that we don't reinvent the wheel. So if there are any enhancements or fixes that have been done by the AMPAC team, we can work with our team to ensure that we can also incorporate that in the version that comes up. So we've been working with Derek from AMPAC. So I don't know, I believe it's the same project that the lady was asking the question. So we've always have contact with Derek, of course, with our developers, Anthony. So we have a way, if there's anything that has been fixed or added enhancements from by the AMPAC team, we can be able to synchronize that so that we can have that incorporated in the mainstream version of AfyaSTAT. So I believe I had missed that question. And then there was a question of the screening. I think it has come up from 3 or 4 people. that when you get the pop-up that it's not you're not eligible for screening, it doesn't stop you from continuing to do the testing. So it's just a pop-up that shows you that this person is not eligible for screening because of that set criteria. But we understand sometimes there's an exposure in between the 1 year, so you can still continue to test. So it doesn't stop you from testing. Over to you, Bernard.
Thank you, Diana, for that. There was a question about synchronization between AfyaSTAT and Kenya EMR. I think the person asking the question stated that sometimes they can see the patient entered on the AfyaSTAT application, but they are not able to see that on Kenya EMR. That means the synchronization has not taken place. I don't know if there's anyone who would want to respond to that. Okay, so I think the simple response would be that one, up to very recent, there was an issue with the SSL certificates for the AfyaSTAT that was kind of preventing the synchronization to take place. So could be that that was the issue with your instance. But I think by so far you must have been already informed that we have the new SSL certificates that have been procured, and they have been shared with all the partners. So if you haven't received yours, kindly contact the point person for Palladium so that you can get the certificate set up, so then those synchronizations can take place. The synchronization is supposed to be very smooth. If at all everything is set up correctly, you shouldn't have any issues with that particular process of synchronization. So just reach out to the point person, your Palladium point person, get the certificates correctly set up, and then try again. You'll be able to have the synchronization taking place. All right. I don't see a hand, so it means we are good. Let me run through the questions on the message in the chat area. I can see most of them have already been responded to. So I think I wouldn't go through that again. What we will do is that we are going to compile all your questions and see the ones that have not been responded to adequately. We are going to respond to them. We are going to kind of like have a spreadsheet where we are going to respond to all those questions that are pending, and then we are going to send them your way through your emails. So expect that within the week, so that we are able to respond to all your questions. Again, on the chat, we are sharing the links to the online resources page, where you'll be able to get the user guides for all this, for the process of how to use the AfyaSTAT, as well as we are going to share with you the link to the YouTube, where you can get additional resources on how to use not only AfyaSTAT, but more of our products. So then you are able to kind of do it yourself. All right. Yeah, so up to this point, I think I just want to give it to Diane again, just for the closure, so that we can hear from her. And again, if there is any other person within the call that might also be given an opportunity to make a remark, Diana will be able to guide us on that. So at this point, I want to give it to Diana briefly as we close this particular session. Over to you, Diana.
Thanks, Bernard, and thanks everyone for being with us for these 2 hours. I'm hoping that the training has been we have met your expectations for the training. I know this is not the last time that we'll be having the trainings. We will share the schedule for the trainings. We plan to have more of our weekly trainings. Some would be just sensitizations, some would just be reminders, so that we are comfortable in using these products in our facilities. So I'm hoping that we met your expectations. If we didn't meet, please let us also know on areas that we can improve next time, so that we can make this beneficial to all of you. I'm hoping we've picked one or two things. So when we are going to roll out this AfyaSTAT in our facilities, we are comfortable. Don't struggle when you're in the field. Feel free to call us so that we can support you. I've put in a link for the SOP for how to configure AfyaSTAT and all the required guides. So you can just go to our website and just get them there. And if you have any questions, you can still reach us. I know Tina will be giving us a summary of the schedule for the trainings that we plan for this month and also next month. So feel free to also give us suggestions on what else we can incorporate, so that we can make the products that we have out there to be user-friendly and also be beneficial to patient care and management in our facilities. So thank you very much for your time and also for your questions. If we have not adequately answered the questions because of time, I think Otieno has suggested that we're going to just put all the questions and the answers, and then we'll distribute through the mailing list that we invited you for this training. So I saw Ndisha from CDC in the call. I'm not sure if she's still in. I think she has left. Yeah, so I don't know if we can just give an opportunity to one participant to just give us a quick feedback for this training, and then Otieno can give us a schedule for the other trainings that we plan to have in this month and next month. I don't know, should I pick someone randomly to just, or I pick any particular partner? Someone has said Mutinda. So Mutinda, I think people know you and they want to hear your voice. If you can give us quick feedback for this session and also just speak on behalf of the attendees. And if you're comfortable, you can also share how we can improve this and make this experience better. Mutinda?
Mutinda, kindly. Okay, go on.
Yeah, thank you, Diane, and thank you, team. We totally appreciate the Palladium team for the great work. As I said, when I was asking some questions, I said, these forms are just excellent. They're actually way better than what we had in Zima, and we're happy with them. We've tried going through the forms, we tried implementing and actually training the teams. We can see great improvement. So thank you so much. I think what I've just mentioned, as Dan has asked, is maybe further engagements. And I'm happy with the statement that the team has made, that we do not reinvent anything. Let's give enhancement suggestions. Let's talk of what can work for us. Let's see how the system can actually be able to help us. One of the things that we're looking at from our end, maybe to give an example, is a system that we can be able to query anything and we get the responses and the system that can be able to help us in programming. That's what we're looking at. Just for the engagement, I think will be very important for us, and we're happy to see this kind of engagement and also taking us through this process. So I think generally we're happy with the process. We just need to continue engaging and seeing how best we can be able to make the services way better. For example, when you look at the guidelines, as Bernard had mentioned earlier, yeah, things have changed, and yes, the guidelines have not been reviewed yet. Yes, I know they are being reviewed. But now when you look at efficiency, because all the time is what is the positivity, how many people are you testing to be able to identify one person? So in terms of eligibility, that is being narrowed down to further beyond the 1 year retesting recommendations. So I think there are a few things that we might need to look at. What are the questions? I know NASCOP has been piloting eligibility screening tool. I know partners are using different tools for screening. So I think something that Diana and team, you can consider maybe putting us together, just have a look at it, see what we have, see what another person has, and then you can be able to put together and have a system that works for everyone. Otherwise, as it is, we'll still reach out at a personal level and also in these forums and get more support. So thank you so much. We appreciate the effort that has gone into this. So I think that is all from us. Thank you, and over to you.
Thanks. Thank you so much, Mutinda, for that feedback. And yes, you're right. Yeah, there's always room for improvement, and we are up to task to ensure that you get everything that the user would require. I think at this juncture, I would want to take it back to Otieno, unless I've seen our lead developer, Anthony Ojwang, is on the call. I don't know if Anthony would want to say something. Well, then I take it back to Otieno.
No, I think everything is okay. I'm sorry I joined late.
Okay, thanks, Anthony. Yeah, so Anthony is our lead developer for the eHealth and also mHealth solutions. So thank you. I'll take it back to Otieno and also thank my colleagues for facilitating this session.
Thank you. Thank you very much, Diana.